Students, I will tell you a very easy mnemonic how to diagnose the location of stroke lesion. You will learn whether the lesion is in cortex, or brainstem, or cerebellum. Okay sir, tell us. There is an interview going on. And there is a woman sitting with legs wide and with a bell. She is the coordinator of office. All people will start and stop their works only after her coordination. She is so arrogant and people will get tremors when they see her. Inside the office room. Candidate is very nervous, but he is very intelligent. His brain cortex works very well, but he is very nervous. The mistake he did is he sit with crossed legs before his boss. And the boss is lady. She is not nervous and sitting happily with crossed legs. She is the main stem of the company. The boss skin tone and voice tone is very good. She scold him with big tone for having crossed leg. But the woman outside the room has bad voice tone, and her voice tone is very less, so she had a bell in hand to call candidates. Now we understood, sir. The lady outside the room has bell in her hands means she represents cerebellum. Yes, bell and cerebellum sounds same. She is sitting with legs wide apart. Yes, wide-based gait is seen in cerebellar lesions. And legs are not crossed. Yes sir, it means cerebellum lesions are ipsilateral. Tell me about brain cortex, sir. I said the candidate has good brain but nervous. Yes sir, and candidate crossed his legs. Yes, he has good brain, it means he represents brain cortex. He had crossed his legs. It means crossed clinical features are seen in cortex lesions. Yes, contralateral hemiplegia is seen. He is nervous. Student, please remember nervous and nerves sound same. It means cranial nerves are working normal in cortex injury. Sir, now tell me about that lady boss. She is the stem of company. It means she represents brainstem and she sits with crossed legs. It means crossed clinical features are seen in brainstem lesions. Yes, and she is not nervous. Means nerve function is absent. Cranial nerves are damaged in brainstem lesion. Yes. Sir, now tell me about tone. I said the boss tone is loud and she is in upper position in company with all the powers. It means hypertonia and upper motor nerve lesions are seen in brainstem lesions and power is not lost. Yes, and the lady with bell has poor tone and she is just coordinator with low position in office with no power. Sir, it means cerebellum has lower motor nerve LM and palsy and hypotonia is seen with loss of power. You are correct. Sir, tell me about that cerebellum lady. She is coordinator, it means cerebellum function is coordination of movements. Sir, any work to start or stop she has to coordinate. Yes, it means start and stop of the function is due to cerebellum. Thus, if cerebellum is damaged, it leads to problem in starting and stopping called past pointing. All people will have tremors. Yes, cerebellar lesions have intentional tremors. This is all important points to remember, students. Imp point is which has ipsilateral and which has contralateral lesions. Please subscribe to my channel for more videos.